North Home Treatment Team, it is a 24-hour functioning team. We manage individuals who are in crisis in their mental state, trying to promote recovery, hope and opportunity within their home, whilst also preventing a hospital admission. If a hospital admission is needed, then we do facilitate that admission into hospital, as well as then support and facilitate discharge out of hospital.
Well, normal day in home treatment team is very chaotic, very fast moving. And basically what we're doing is trying to support people in crisis, trying to facilitate care within their own environment, which is optimum for their recovery, and also facilitate early discharges from the wards, and just to promote recovery to the best of our ability.
First you come in and you have to take a handover, help out with the med reviews, do daily visits, sort out the medications for our patients, and to make sure that everybody's happy, and continue to come back and give handover, carrying out assessments in between. So it's just busy, ongoing until you leave to go home at 4 o'clock.
They look after their staff, they nurture us, as well as trying to get us to provide the best service possible. But they also look after us as individuals as well, particularly if you have a good manager like I have. So yeah, that's what makes me proud.
Levi came to the team in February of this year. He came from CAFRA Intensive Care Unit, where he'd worked as a staff nurse there. He's a band 6 CPN within the team, and his role is about facilitating and coordinating shifts, conducting visits and assessments, and then also supporting other members of staff plus the junior members of staff as well.
He's a very caring person, someone you can actually rely on. He's compassionate in his work, and he is very caring where the patients are concerned. He likes to go that extra mile, which sometimes I feel jealous. But overall, he's a wonderful nurse, a wonderful person to work with as well, a great team worker.
He's very personable, he's very likeable. He is always very relaxed, very happy, very smiley. He genuinely cares, not just about the service users, but about the colleagues and about the carers. He's very committed to his role as a CPN, and he's constantly wanting to learn more, like he just wants to learn all the time, just to make sure that he can actually better himself so that he can perform his task better. I nominated Levi for the HCAs award because Levi is actually very humble. He never ever tries to praise or take credit. He just gets on and does the job, and actually he works very, very hard. He's a very dedicated member of staff, and so because of that reason I felt that he deserved the recognition.
When I found out my manager had nominated me, I was pleased and I was pleasantly surprised. Nevertheless, I felt as though I hadn't done anything special. It's, as I say, I've been working in mental health for 17 years, and all I've strove to do is to treat people with dignity and respect, and try and understand, and this is the same thing I do within the home treatment team. That's it.
As part of my role as the team manager, I tend to have a fair bit of contact with the service users, mainly when they complain, but also when they give compliments, and they would contact me, and I've had several service users contact me to say how actually they love Levi when he visits, that as soon as they see Levi at the front door, they have a smile on their face because they know that he will listen, that he will understand, and he genuinely wants to help them, that they can just see that his compassion is there for them.
During your time of crisis, you may be faced with feelings of despair. Holding tight to your emotions, they are personal, not easily shared. You may be feeling vulnerable, exposed and bare, and I cannot guarantee a solution, but I promise to care. You will find me listening attentively. I'm focused on you, so forgive me if I stare. See, your problems are my passion, and I know this supersedes the conventional expectations of a job description, but for nurses, compassion fuels our motivation. This motivation permits us to want to understand the hidden meaning of your behavior, your needs and demands. and at times your behavior and your words may cause lasting damage. Nevertheless, I am committed to this task, so I traverse with courage. Undoubtedly, ambivalence will at times obscure my sense of direction. You are central to this map, and our treasure is your opinion. We shall discuss obstacles and hurdles with those who know. Effective communication is imperative for this alliance to grow.